Hello, my name is Anicia Claiborne, and I am a MSOT student attending Kaiser University, completing my level 1 rotation 2 fieldwork at a community sensory gym. I will be speaking on a case study. Being that I am a student, if I were in OT, these would be the interventions and models and theories that I would use within my evaluation and intervention sessions. As an OT student, my role is to identify psychosocial factors such as emotional regulation, communication, and social participation that limit a child's engagement in occupation. The child I observed is a 3-year-old who struggles with sharing, turn taking, emotional regulation, and expressive language, which impacts his ability to participate in play and peer interactions. If I were to perform the intervention, I would use an individual play based intervention focused on emotional regulation and social participation. The session would begin with a sensory regulation warm up, followed by a structured turn taking play activity using preferred toys. I would use simple visuals and verbal cues like my turn, your turn, his turn, her turn, whose turn is it, who goes next, and model the appropriate social behaviors. By providing the sensory warm up in the beginning, I would be able to have the child to reach his optimal arousal level, which in return should have the child be more accepting and comfortable as I implement the modeling and the physical, verbal, visual cues, aiding in appropriate behaviors. I chose this intervention because the child's emotional dysregulation and limited communication significantly impacts his occupational performance. Play is the primary occupation at his age, and embedding coping strategies into play helps reduce frustration and supports meaningful participation in social activities. The key is to use the games, activities, and equipment within the gym that's more preferred, which should, again, in return, allow me to have a greater success in implementing the model for a better carryover as I begin to give less intervention and have the child to guide himself to see how he reacts and how much he's learned within the session using the techniques that were provided. The primary psychosocial frame of reference I selected is the coping model supported by sensory integration theory. The coping model helps children develop strategies to manage frustration while sensory based activities support regulation so the child can successfully engage in play. If psychosocial factors had minimal impact, the intervention would focus less on regulation and coping strategies and more on independent play and skill development, such as a craft that has multi steps working on following directions and sequencing steps, or fine motor skills to be able to refine a pincer grasp or the tripod grasp during handwriting activities. There would be fewer visual supports and less adult facilitation, allowing for more spontaneous peer interactions. If given the opportunity to conduct this case study, an intervention session again, I would include more visual communication supports and increase caregiver education to improve carryover at home, and also within the various environments, prepping the child for school readiness. These changes would further support emotional regulation and social participation once it comes to that time, and especially if there's less structure or less amount of time for an adult to be able to provide that one-on-one intervention with the child, either in a classroom or at maybe a peer's birthday party and the parents weren't there at the moment. Carryover should be able to be seen within these environments just for a greater success for the child within the realm of participation and managing emotions. In conclusion, the intervention highlights how occupational therapy addresses psychosocial factors to support engagement in meaningful occupations. Using a play based approach and psychosocial models, which allows children to build emotional regulation and social participation skills in a developmentally appropriate way.